Welcome to Sunstar Gum's virtual training on interdental cleaning to prevent and treat gum disease, where we review the state of the evidence and work out what it means for you. You're about to discover Module 4, in which we explore the latest available evidence on the role of compliance in interdental cleaning. Module 4 is part of a series of 4 training modules based on the evidence from 17 randomized controlled trials and 6 systematic reviews and meta-analyses. One expert will guide you, Filippo Graziani, professor of periodontology at the University of Pisa and past president of the EFP, the European Federation of Periodontology. Module 4 on compliance was developed to explore the evidence base for patient preferences in interdental hygiene and look at the impact of compliance on outcomes, to increase your comfort level in advising patients on the best interdental cleaning approach for each of them, and finally, to allow you to benefit from expert faculty commentary and explanations. Let's hear the expert. What is the role of compliance in oral hygiene?
I think that compliance is the base of oral hygiene. In fact, one of the main difficulties that we have as professionals is to change the habits and the behaviors. And changing behaviors, as we know, is one of the most complex issues. This is not just because it is difficult per se, it is also difficult because most of the time we are not trained to let people change in their behavior. And to do so, we just don't need to inform people, but we also need to trigger something in themselves that actually would bring them to a new person, a new life.
Is it true that compliance is driven by patient attitudes, not by technology? The EFP and ORCA issued an expert consensus stating that a patient's ability to clean their own teeth effectively is the most important factor in managing gum disease. So, what does the literature tell us about the role of compliance in gum disease? The prevention and control of gum disease is a lifelong commitment, and gum disease can only be managed with good compliance. Compliance with a daily oral hygiene routine is one of the greatest issues in dental care, simply because patients often do not follow recommendations from healthcare providers. Flossing is difficult and associated with low compliance, which is why less demanding methods of interdental cleaning have been found to be associated with increased adherence. What the cumulative experience recorded in the literature tells us is simple: ease of use drives compliance. Providing patients with easy-to-use dental care tools is a simple and effective way of improving compliance. Let us turn to interdental cleaners and compliance. What is the evidence? Compared to floss, there are 3 key benefits associated with easier-to-use interdental brushes and rubber interdental cleaners. First, they are associated with increased patient motivation and therefore compliance. Second, RCTs have demonstrated their greater efficacy at removing plaque. And finally, studies indicate they improve patient outcomes. So, what does the literature tell us about patient preference for interdental brushes versus floss? How do we measure patient preference? 3 RCTs spanning over 1 decade independently come to the same conclusion. Interdental brushes are easier to use and drive compliance. Neuralin reports that 90% of patients found interdental brushes easy to use, compared to just 60% for floss. IMI found that a stunning 93% of patients agreed to use interdental brushes daily, compared to just 67% for floss. In 1998, CRISTU reported that just 12% of patients had problems using interdental brushes, a considerable difference with the 58% of patients that reported problems with floss. Let's hear the expert. What can you tell us about floss versus rubber interdental brushes and rubber interdental cleaners?
I'm not very negative towards floss. I just think that I want to be realistic. It can be effective, but it requires a great deal of training. And not everybody can master it in such a short, limited amount of time. You have to bear in mind that you might be somebody under 65 and one day at your dentist you are told that you have periodontitis, and in one day you need to add something to your mouth, to your daily practice, and maybe you have just 10 minutes to learn how to do it. Floss is actually very efficacious, but is extremely complex to be used. That's why I think when you put together efficacy and effectiveness, which means the capability to remove plaque, but also the amount of sessions that are needed to remove plaque, interdental brushes are by far superior. The only issue comes on the fact that you might not be able to use interdental brushes all the time. In that case, you might have floss, or even, for example, rubber interdental picks that I found extremely helpful. That's why we ran a trial on that.
As technology moves forward, interdental cleaners have been improved continuously, taking patient preference and adoption to the next level. In terms of prevention, Abu Asi found greater patient acceptance and willingness to buy rubber interdental cleaners because patients found them to be even more comfortable and to cause less pain than interdental brushes. In terms of treatment, Dr. Sloat's study reported that patients found rubber interdental cleaners even easier and more comfortable to use than interdental brushes. This tells us that rubber interdental cleaners may be the best tool we have to prevent and manage gum disease in the low-compliance population. Let us take a closer look at patient feedback in Dr. Sloat's study comparing rubber interdental cleaners with interdental brushes for their ability to reverse gingivitis. This figure reports outcomes for interdental brushes and rubber interdental cleaners. Patient preference is reported on a sliding visual analog scale from 0 to 10. 10 indicating greater agreement with a statement, either a positive or a negative statement. Patients found the use of rubber interdental cleaners significantly more pleasant than interdental brushes. Very few patients found either product to be scary to use. Some patients found the size of both interdental brushes and rubber interdental cleaners to be too big, indicating the importance of recommending the use of different sizes. Both tools were found to be of appropriate quality. In summary, the evidence indicates that a patient's ability to clean their own teeth is the most important factor in managing gum disease, as stated by the EFP and ORCA, and that rubber interdental cleaners are even easier to use than interdental brushes. The implications for dental practice? Interdental space permitting, recommend universal use of rubber interdental cleaners, alone or in combination with interdental brushes, as the new standard of care. If you haven't already, why not check out our other modules? If you found this interesting and would like to take a deeper dive into the literature, head to the Sunstar Gum website to download the white paper and a full set of slides.